Hey guys, and welcome back to the Second Opinion Podcast. I'm your host, Jesse Manchushan. In today's episode, we are going to be going skin deep with Dr. Weiss, dermatologist extraordinaire of CHEMED. In today's episode, we're going to be discussing all things skin related. Skin health, what's normal, what's not. Is that something to be concerned about? Is that weirdly shaped? Rashes, acne, moles, skin cancer, melanoma, which is skin cancer. This episode will help you better understand your skin, your family's skin, how to take care of it, what you can and can't do, and most importantly, what actually works for your skin and what's just really good marketing. Hope you guys enjoy.
When a child plays, he's not just playing. He's in his own little world. It's big, it's safe, it's where he feels brave. So why take him out of it and into a cold, crowded waiting room? With Rite Care, he stays right where he belongs, surrounded by the toys he loves in the comfort of home. Real care, real comfort at home. Rite Care, at home, just a call away.
Dr. Weiss, thank you so much for joining us. This is a topic that I personally have been wanting to cover. We'll start in the beginning, like what is dermatology? What is it not also?
So dermatology, you can divide it up into several different fields. There's medical dermatology, where we treat with medications, whether they be creams, injections, oral medications. There's surgical dermatology, and surgical dermatology can be very, very simple things, like just taking off a wart or destroying a wart, taking out, excising melanomas, serious skin cancers. And then there's very sophisticated dermatology, like Mohs chemosurgery. It's getting more and more sophisticated as time goes on. There are other modalities also, ultraviolet light and things like that. And then there's subspecialties in dermatology, like some people are only looking at the microscope, dermatopathology. Some people are specializing in pediatric dermatology, some people only in geriatric dermatology. So it's a very, very wide field. I like it because I practice general dermatology because I get to do a little of everything. I do medications, I do surgery, and it keeps me interested and keeps me awake.
Is there that much of a difference? As someone who's ignorant to this, the skin is the skin. No, it's not. There would be a difference between pediatrics and geriatrics in dermatology.
There are a lot of different things you have to take into consideration when you're treating a child. Their skin is much more sensitive. There's technically a lot more absorption through their skin that can get into their system, but by and large, I don't worry about that too much because we're pretty careful with the medications we use. But it's a really field unto itself.
And you had mentioned melanoma, which I believe is cancer.
It is cancer.
Okay, good. And it stems from something specific, or it's like
most of the time, 90% of the time, it's from sun damage. So it takes time to develop it. But there are some times where the melanoma can present in unexposed areas and in young people. And everyone's concerned. I see people every day who come in to check moles. They're just nervous about it. When I was in Brooklyn, I tell the patients, when I was in Brooklyn, I used to see 60, 70, 80-year-olds for general skin checks because they accumulate a lot of sun damage. Here in Lakewood, for some reason, 20, 30-year-olds are nervous about it. So they're coming in, the skin is perfect, no sun damage whatsoever, and they just want their moles looked at.
Really?
So
is that I think, with awareness comes that sort of idea, especially with marketing. The only reason I know what melanoma even is. I don't think I know anyone who has ever had melanoma personally, or not that I know of that they had it. But there's radio commercials and there's thing, and it's one of these buzzwords. Get that checked. Then people tend to get a little over trigger happy with with having things checked.
Two good points, two interesting points there. Yeah, number one, it's definitely very popular. Skin cancer rates in the United States in general are going up. People have more leisure time, and there's more sun exposure. In our community, I think we're a little more limited because of tznius issues, but it still happens quite a bit. And then you mentioned knife happy. Some people, will come into a dermatologist and they want something looked at, and the dermatologist may say to them, "Well, we'll never know unless we cut."
Yeah.
So sometimes it's necessary, sometimes it's not. But personalities are involved in medicine also, just like by the patients.
I think dermatology is also unique in the way of it's probably the doctor who gets the most awkward questions, I think, from just about all medical professions. I mean, there's going to be people, maybe dentists, I don't know. They have to, someone in shul is going to come up to them. But, I'm sure you've been pulled aside in shul and some guy starts taking his shirt off.
It's happened to me. It happened to me this morning, as a matter of fact, after davening. And it's happened to me at chasnas. Someone even pulled up his shirt in the middle of the dance floor. But
has it ever happened the other way that you're
I don't
you're
pull my
at the
shirt
public
up.
pool?
I don't pull my shirt down.
But you're at a public pool. You're at whatever it is. You're at a camp or something. You're like, that person should have that checked, and I don't think they know about it.
Sure. Yeah,
You
I've seen that in my younger years. I saw somebody once at a pool, and I didn't say anything to him. It looked like it was something that should be checked. And I kicked myself till today that I didn't say anything to him.
Yeah.
But on the other hand, I don't want to make people nervous. People are nervous as like crazy anyway today because of everything they read and hear, and they have friends that have this and that. So,
how treatable is skin issues, or are skin issues in general?
Well, if you're talking about the skin cancers, the earlier, of course, you find them, the more curable they are. So melanoma in situ, which is a very early melanoma, is 100% curable. The longer a person waits, then of course it changes the statistics. In regards to treatment in general, there's more and more things happening in dermatology than ever before. When I was in my residency, we had creams, a couple oral medications, a handful of oral medications. Today, there's a whole new world of biologics and targeted therapy.
Interesting.
And that is just exploding daily. There's a new drug on the market every week.
Interesting.
So we can do a lot of, do things. We can help a lot of people today.
And different skin on different parts of the body. Is the skin, or is there more sensitive parts that we, like our eyelids? Are we supposed to be more careful about our eyelids than our earlobes? Just choosing it around our neck? I don't know.
Yeah, no, there is a difference there. First of all, exposed skin is exposed to the sun, so it's much more sensitive to those type of issues. Eyelids, that's the thinnest skin on the body. A lot of irritation there, a lot of allergic reactions to cosmetic shampoos, soaps, aerosols. All these things can irritate. As opposed to they can have a rash on the eyelids and nowhere else in the face. And I tell them it's shampoo, but it touched the rest of my face. So I tell them, your eyelids, that's the most sensitive.
Right. Interesting. I hear there's a lot of buzz around deodorant, aluminum versus is that a real I never trusted it. I don't know what's marketing and what's not anymore.
Not to me. I mean, it was an issue, I think, in front of Congress a while ago.
Oh wow.
But I think they cleared it. So
really?
you can start using your deodorants again.
Oh really? Okay, fantastic.
And the antiperspirants have a lot of aluminum in them. Now the prescription antiperspirants have aluminum in them. And maybe that's why there's such an increase in mental health issues. I don't know.
Oh, yeah, there you go. Was that? I thought it was a skin issue that too much antiperspirant was bad for people's skin. It was.
Some people are sensitive.
Okay.
That's very treatable. That's easy.
Okay, I would assume the most. I mean, aside skin cancer aside and moles aside, I would assume the most visited reason that people are there are things like acne.
Correct.
which isn't just of the face. There's body acne and face acne, if I'm not mistaken.
Correct.
So is there a difference between the two?
They're treated basically the same. Yeah, a lot of people ignore the body acne because people don't see it.
Right.
But I try to impress on people that it's important to take care of it, because if you don't treat it, it can lead to scarring. And the scarring is permanent. Mm-hmm. The acne is not. People don't want to come, especially a lot of the boys are in yeshiva and they don't want to take off time. It doesn't go very quickly in the waiting room, so they lose an hour or two there. But it's important because, the kids, when they get to shidduch age,
they want to make sure
they're looking both ways.
Yeah, for sure. And I mean the cosmetic side of it, in general, is there any truth to the diet of it when it comes to acne, or is it just a heretic?
So it's a very, very good question. I would say that there were studies done in the 1950s where they tried to associate or find an association between food and acne, and 95% of patients didn't have any association whatsoever.
Interesting.
So I generally tell the patients, if you notice something, if you're eating fried chicken or pizza and you break out, then just avoid it. But I can't tell them what to avoid. Today, I think things are a little different. They're looking into food a little bit more. I think there's a lot of, in order to get the volume of meat and milk and eggs to the community, animals are being treated with hormones. And some of that stuff does trickle into our diets, and these hormones can have an effect on some people who are very sensitive. But in general, food doesn't have that much to do with it.
I know, as far as, I'm sure there are adults. I've seen adults with it. I know adults who have it, but I think things like eczema, psoriasis, things along those lines are probably more common in children. So I'm assuming that they're coming more often. What's the cause of the eczema, the psoriasis?
Nobody really knows. It does travel with allergies. Sometimes the allergies have a direct impact on the causation of the eczema, and sometimes the eczemas will cause allergies, but most of the time they just travel together. The allergies, the eczema, and asthma, it's a triad.
Interesting.
What they call
There's a connection between the eczema and asthma?
Right, yeah. Again, whether one causes the other to worsen or not, but you do see more allergies and asthma in eczema patients. Most of the kids that have childhood eczema will grow out of it.
Oh, okay.
But there are some kids that'll persist to teenage years and even adulthood. Mm-hmm. And the main issue there is we want to keep them comfortable, because when they're not comfortable, they scratch, they bleed, they can get infected, and infection is a sakana. Mm-hmm. So we got to make sure that's under control. There are studies today showing that both in eczema and psoriasis, it's not only the inflammation of the skin that's going on, there's inflammation internally. There are numerous inflammatory molecules and cells that are floating around that have a negative impact on blood pressure, diabetes.
Interesting.
And many other things. So that's where the biologics come in, because the biologics are a systemic form of treatment which can decrease all these inflammatory molecules.
And there is a way, I'm saying there are anti-inflammatory methods to use.
Yeah, the biologics are fantastic. Yeah.
Well, and that would work for the psoriasis on the outside as well.
Yeah,
interesting.
Yeah.
I know some people, it's in my family a little bit, psoriasis. Someone, sent me a thing and I couldn't imagine how dangerous information this was. And I said so, but because they're vegan, they do not put sunscreen on their children. I don't know what the connection there was either.
I don't think these things are animal derived.
Right. Yeah. I don't know what it had to do with it. But the importance of sunscreen, though, especially as we're going into the summer right now, are there people who need it less than others? There are people who for sure need it more, that I've seen with my own children. But me, I'm of Moroccan descent, and it just I don't know if I've ever really gotten. I think one time I've gotten a sunburn. I don't think it really. And I didn't really grow up with that much sunscreen going around.
Technically, there are 5 types of skin that was categorized way back in the probably 60s, 70s. And the fairer the skin, the more they need the sunscreen, the more they're exposed to damage. People with darker complexions have a little bit more protection, but they do talk about skin cancer and sun damage, and and Afro-Americans and people with darker complexions.
Oh,
So
interesting.
it is a real issue.
Oh, interesting.
Well, it's sometimes harder to pick out because there's not a good contrast. You don't get a light background.
And is there like a bump in anything recently, past few years, that you've noticed that people are not noticing or overlooking or not, paying attention to by way of, maybe the sunscreen, maybe anything else?
Sunscreen is the big problem with sunscreen is it's a pain in the neck. Kids want to get out there and play, and their parents are calling them back in, to put the sunscreen on before, and sometimes it feels a little tacky. So the kids don't want that, but it's a question of training, like brushing teeth. So you got to apply, and the main thing is to apply and to reapply and to reapply, because the sunscreens do get washed off, rubbed off,
Interesting.
And so you have to do it, before they go out, after lunch, if they come out of a pool, to reapply it. And the sunscreens are marked how long the sunscreen will last on the skin. Sometimes they'll tell you 60 minutes, 80 minutes.
Interesting.
Yeah.
And spray or lotion, or is that just a personal preference?
That's a personal preference.
Doesn't matter.
Yeah, but there's one misconception I think that people have, and that is if they see an SPF, which is the sun protection factor, which is high, they think they're protected for the whole day. That's not true, because of what I mentioned before, that the sunscreen doesn't stay on your skin forever. That's number one. Number two, the higher the SPF, the more chemical you're putting on your skin, and the more irritating it can be also. So I usually prefer to tell patients to use a low SPF, like 15, 20, 25, and just to reapply and reapply.
Oh, interesting.
I think it's a nicer way to go.
And the higher SPF is staying on you longer? Is that why or it's just marketing?
No, I think the stay on time depends on how it's formulated. It has nothing to do with the SPF.
Interesting.
But it's supposed to give you longer protection. But again, I think it doesn't stay on that long.
Interesting. And now, just sliding a little bit into the aesthetic part of skin. So, according to most people that I've spoken to, apparently a lot of this is genetics. As far as people with good skin, people with sensitive skin, people with blotchy skin or not, even acne is all these things basically fall under genetics. But if you have someone who's not, right, does a person hydrating properly matter? Do these things, is there anything we could do for our kids when they're younger to give them a better chance at better skin when they're older?
Yeah, well, the two things are genetics and sun exposure. So the genetics you can't really do much about. But the sun exposure, you can protect the person's skin. Now, even the skin, if the skin is sensitive and it is damaged, there are ways today, whether it be creams or laser or other techniques that can revert the skin back to what it used to be. Not 100%, but we get them back. We can decrease wrinkling, mottling of the skin. So there's a lot out there today.
This is something that, again, a little bit of a buzz term, but we see it all over, where the routine, right? So no matter what it is, whether we're dealing with diet or vitamins, or everyone wants a routine that they can follow to. Is there anything specific that for the average person that you recommend as a routine? In other words, your daughter, I don't know if you have a daughter, but your daughter comes over to you and says, what can I do to make sure that I keep a nice, clear skin through my...
Right. So, a lot of it's common sense. Soaps are very important, but sometimes people are too attentive to getting every single, piece of oil off their skin. So they use soaps that are too harsh for them. I think they should use milder soaps. It'll dry them out less. When it comes to boys, I think it's just a question of, washing your face in the morning, washing your face in the evening. That's really about it. When it comes to girls, especially women, they're interested in putting moisturizers on and preventing this and preventing that. They're much more into their skin than the men are. Sometimes too much, because I think they dry their skin out too much. I tell patients all the time. They say, they ask me, which moisturizer should I use? I say, you don't need a moisturizer. Your skin is fine. You don't have to do anything for it. And sometimes the moisturizers create problems because they can plug up pores, create artificial acne, and you get into another situation.
Right. That was my two questions my daughter asked me to ask was these were
okay. That'll be $50 copay.
Which moisturizers is she supposed to be using, and how to prevent blackheads? Those were her two. She demanded that I asked. I said I'll go for it, but I don't know if there's what to say about it. But also, and wrinkles. I know people are always, especially women, are always trying to prevent wrinkles, and they're using moisturizers. They're using all these things. The retinol creams, all these things. Are any of these things like just snake oil? Are these things healthy for them?
Retinols are over the counter, but retinoids, which are prescription, there are three creams that really work for wrinkles. The retinoids, which are the prescription retinols, if you want to call it that. Then there's vitamin A and vitamin C. There's the fourth one also. There's alpha hydroxy acids. They help a lot for wrinkling. So some of the stuff is over the counter. I just saw for the first time last week, vitamin C used to be prescription. There's a new vitamin C. I don't remember which company it was, but it just came out. It seems like a nice item. So I'm trying it out in my family. So,
that's everything. Listen,
we'll see how it works.
Those are our best guinea pigs.
Right.
Usually our malpractice doesn't get bothered by us using our family as. So, I mean, in the anti-aging realm of things, I mean, I'm assuming most of this is marketing, only because when you get something like that big, and it's like $80 or whatever it is that I see in like a duty-free or Dead Sea products or any of these
women
things.
are willing to spend it.
Yeah. Oh, no, I know they're willing to spend it. I'm asking, is there any legitimacy behind any of it?
I think some of the products on the market, over-the-counter products, are good. Some are very good, but a lot of people have misconceptions. The other thing is that some of the molecules in these creams are very, very large, and they're not going to penetrate the skin. So they're not going to make a person get rid of the wrinkles by increasing their fibrous tissue. It just doesn't get in. Mm-hmm. But that's exactly like you said. That is a marketing issue. To get that in, you either need to inject it. And you need to inject it. Even if you took it by mouth, it's digested by the stomach before it gets to the skin.
Interesting.
So
wow.
Yeah, and then it
as
doesn't
long as you're
last.
not injecting something, you should take a second look at it.
Yeah, and then it doesn't last that long. Even if they inject fiber into the skin, it lasts 3 to 6 months, and it's expensive.
Yeah,
and there can be allergic reactions.
Sometimes it's just better to age, I think. What is something to look at? I mean, again, I don't want to overstate the idea that people are just more scared nowadays, whether it's because of clickbait or buzzwords or all these things that just get people that way. But what are things that shouldn't be overlooked? If I see something on, God forbid, my skin, my kid's skin, something changes, doesn't change. What's something to, we actually, I think, just did Saras in the Parsha.
Right.
So, what's something not to overlook that we should say, like, you got to go get.
So let's back up to birth. So the kids today are being seen by very, very good pediatricians around town. And as we get older, they're seen by very, very good internists and OBGYNs. So their skin is being looked at. So if they have a baseline examination and the doctor sees moles, if he's confident that there's nothing to worry about, that's a good baseline. If he's not confident, then send them on to the dermatologist and we'll take a look at it. But the thing is that once you have a baseline, look for any change, whether a mole gets bigger or smaller. If a mole gets smaller, it doesn't necessarily mean good, because the body could be sensing something and it wants to destroy it. And likewise, if it gets lighter or darker, then it should be checked. So any change should be looked at. Mm-hmm. So you have a baseline. If you're happy with the baseline, then go on with life. And if there's any question or if there's any change at all, then by all means.
Mm-hmm. And anything new versus old. So you're giving a kid a bath and there's a new mole on their back you didn't see before.
Most of the moles that we have by the time we hit 120 are what we call acquired nevi, which means that most of them come midlife. And midlife can be anywhere from 2 years of age to 120 years of age.
Oh.
So congenital nevi are moles that were born with or within the first 6 months of life. But the acquired nevi are much more common, and that's what they're bringing to the office.
Mm-hmm. Interesting.
Yeah. I think the misnomer is they call birthmarks. They're not birthmarks.
Right, yeah, because they weren't. That was actually a question I always wanted to ask. I don't know if they're going to include it. You know when people have like the purple or red tag on their face. What is that?
Those are hemangiomas usually, and
Are
they
those
come
dangerous? Are those is that
so
genetic?
they come in various forms and types. Most hemangiomas are not dangerous. There are some that can have an internal connection to the central nervous system or to the vascular system, and they can present a problem, or they may represent another problem, just be one part of a syndrome.
Interesting.
So they should be looked at. Yeah, but most of the hemangiomas we look at are not a problem.
Interesting. Asking for a friend. Is there any cure to hair loss? It's on the thing. I don't know. I gotta ask it once it's on. It's on the list.
The word cure is a hard word. We're not going to get them back to when they were 13 years old, but there are methods today of stimulating hair growth. The most common used to be prescription. Now it's over the counter for many years already. Is Rogaine, which is minoxidil. It works. It does work. There are oral medications. There are surgical techniques. Some people are extracting blood from patients, separating the platelets, re-injecting the platelets back into the skin where they want to stimulate hair growth. And that works. We're not doing that in CHEMED yet.
Interesting.
Yeah.
I never even heard of that one.
Yeah.
I just knew about people flying out to Turkey to get
The hair transplants.
hair transplants.
Yes.
I saw some of it. I don't know. It looks like doll hair. I'm not sure. I don't know what's going on.
Yeah. Sometimes you can tell.
Yeah. I don't
Yeah,
know.
you have
That
to
one
be.
doesn't.
It's an art. You have to be gifted surgeons to be able to do it.
Yeah, my son has on both sides of his family hair loss, and yeah, he's like, I just hope they come out with something before I start. He's like 14. He's like, maybe before I start, they'll have the thing that prevents it, and get rid of it.
This week I saw 2 teenagers so far this week. What are we up to, Tuesday? 2 teenagers that were worried about hair loss. I just told them to start using Rogaine, but they've got a long time to go.
Yeah.
Using it for a long.
Yeah, I assume the preventative of it is a lot easier than trying to get it back after
That's right.
After it's been gone for 15 years.
Right. I usually tell them if you have an area of hair loss, like an adult is missing hair for more than 5 years, those roots are probably dead.
Yeah,
it's like growing hair in your palm. It's not going to work.
It's not going to happen.
But if you catch it early, then you can re-stimulate the hair to grow.
Interesting. Okay, listen, I definitely will try. Someone told me about a needle roller. They will come up with the craziest of things. I mean, maybe that works. I don't know.
Yeah, it's supposed to.
Yeah. Well, yeah. Listen.
I don't do it, but we're supposed to be getting somebody in CHEMED soon that does that.
Oh, really?
Yeah.
Oh, it's a real thing. They call it the microneedling.
Microneedling, right.
Interesting. See, I don't.
Yeah, we're expanding.
No, but also you never know, like what is a real thing, and some things could look crazy, but no, that's a legitimate, it's a legitimate thing to use. That's amazing. So I think my grandmother always used to tell me that a person's skin, you could tell from a person's skin how healthy they are. Like she said, when you shake their hands, how soft their skin is.
They never gave me a course like that.
They never gave me a course like, yeah, listen, my grandmother, as the years go, a lot of things, a lot of things I keep calling into question. Okay, so we have a tradition at the end of all of our episodes where I like to ask if there was one thing you wish the general public knew about skin, about dermatology, about health of dermatology, that if you said it now, you could just put it to rest and you'll never have to revisit it again.
Yeah, I didn't know there was such a thing. Yeah.
we have that size of a listening base.
Okay, that's an interesting question. I think that just like when it comes to vaccinations, you have your vaxxers and anti-vaxxers. You have the same thing with people out there who are afraid of medicines. There's a stigma attached to steroids, even creams. There's a stigma attached to oral medications, and many people, I think it's personality, maybe I don't know if it's education, but it's certainly personality, where they will not want to put a medication into the body for something that they think is quote unquote cosmetic. So I think that we've traveled a long way, and the medications we have today are fantastic, and they're very, very safe. I haven't seen anybody recently that has had any major side effects from using any of the creams, except for occasional irritation. But in terms of major internal side effects like Cushing's disease, if they're using too much steroids, we don't see that anymore. Same thing with the oral medications. Most people, a drug can't get on the market in the United States unless the FDA says that 95% of people will be benefiting from it. There's going to be your 5% or hopefully less that will have a problem with it. But the drugs today are very, very beneficial, pretty safe, pretty risk-free, and sometimes it takes a lot of work to just dispel that fear from people. I have this as a constant issue when it comes to fungus, especially fungus on the feet. So 80 to 90% of people with cellulitis, especially older people, have fungus on their feet. So skin is easy. You can give them a cream. Pretty much everybody's willing to accept that, even if it's a little bit of a tircha to put on cream morning and night. But when it comes to nails, I've got to convince them that the medications they're going to be taking by mouth is not dangerous. But there are very, very, very good studies out there. They've been repeated numerous times to show that the drugs are safe and effective. And then you can prevent a lot of problems. I'm sure you go to shul, you hear about this guy's in the hospital with cellulitis, and so fungus is a major issue out there. But people just have to realize that the medications, and we're not exposing them to large amounts of medication. We're giving them the minimum that they need to get the job done. So I think it's pretty reasonable today.
Wow. All right. Well, Dr. Weiss, thank you so much. Anybody wants, Dr. Weiss is the dermatologist at CHEMED. We have, Baruch Hashem, CHEMED has been sending us a steady stream of their professionals. So we very, very much appreciate you taking the time to be with us today. Hey guys, thanks for joining us today. Thanks for watching the episode. Here at Second Opinion, we're always trying to have you be the one who makes the second opinion. I hope today's episode allowed you the information and access to that information enough to be able to decide for yourself. If you like today's episode, if it spoke to you and you want to see more, we got more. You can access our podcast on anywhere, any platform where you get your podcast. Apple, Spotify, YouTube, wherever it is, we're on there. Video, audio, you got it. Please remember to like and subscribe. And again, thank you guys for joining us.